Hello everyone, my name is Tom and I'd like to welcome you to ADO's July webinar. You may have noticed temperatures are rising outside, so we put together this presentation on all the potential health hazards you might encounter this summer. To help us shed some light on the topic is today's speaker, Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you, Tom. So yes, today we're going to talk about some of the hazards of summer. And here's a beautiful picture of the sun, and is what we all associate with summer. Why is summer so wonderful? Well, it's nice and warm and sunny. But make no mistake, the sun is the enemy. The sun can do lots of damage, and we're going to go through some of that today. The main way that the sun does damage is, of course, its ultraviolet rays. And the sun has two different types of ultraviolet rays. It has the ultraviolet UVA, ultraviolet A rays, and the UVB rays. Now the UVA rays actually penetrate deeper, but they kind of have low energy and they don't do as much damage in terms of what we're really worried about, which is skin cancer. However, make no mistake, they are still damaging. They are what make you look old. When you see that person with the old, grizzled, sun-exposed look to them, that's those UVA rays that work, that has eaten through the collagen and the parts of your skin that are underneath the surface layer to make you have wrinkles. Then there's the UVB rays. They're much more powerful, but don't penetrate as far. They're the ones that affect that top layer of skin and, most dangerously, can lead to skin cancer. Now, make no mistake, those UVA rays, even though they're a lot less dangerous in terms of skin cancer than the UVB rays, they still have the potential to cause certain types of skin cancer too, so they're not to be trifled with either. So this is somebody who obviously has a sunburn. Probably they didn't put their sunscreen on quite right, because you can almost see the handprint of where they tried to rub a little bit of sunscreen on their arm. Sunscreen is the first outward evidence of sun damage from these ultraviolet rays, both the UVA and the UVB. But we do have some defense against these rays, and we'll see that on the next slide. Sunscreen. Here you can see some sunscreens of various types with SPF factors ranging from 30 to 35 to, I think, 55 on that one on the left. These SPF factors, sun protection factors, are based strictly on UVB, how they protect you against the damaging rays that can cause skin cancer. Many of them do not have protection against UVA rays, and you have to be very careful when looking at the labels to make sure that the one you pick up also can block UVA rays. There are some sunscreen ingredients that only block UVB rays, some that block only UVA rays, and some that block both. So make sure when you're buying your sunscreen that you get one that protects both of them. Even so, there is only limited good that a sunscreen can do. They oftentimes have these cool names like Cool Dry Sport and Water Babies, and suggest that they are waterproof. Waterproof is very relative when it comes to sunscreen. There is only so much water resistant that a cream that you rub on your skin can have. And you will see in the fine print on even the most waterproof of sunscreens, they say, reapply every 30 to 60 minutes when you're actually out in the sun or the wind or the water or any place that you would actually be with sunscreen. I have young children. Let me tell you, getting sunscreen reapplied to a 4-year-old every 30 to 60 minutes or every time they come out of the water is darn near impossible. So because of that, one of the things that I'm going to recommend is swim shirts. You've probably seen them in most sporting goods stores and even Walmart and Target. They're made out of similar material to what you find in bathing suits. They dry off very quickly, and they provide all day long protection with a high SPF, even when you're swimming, even when you're lying out, and you don't have to keep reapplying because it's a shirt and you can always be wearing them. Now, some people who wear these swim shirts, which are oftentimes short sleeve, then forget to do things like sunscreen their face and their neck and their arms, and those things still have to be paid careful attention to because you can get skin cancers and skin damage, especially on your faces, where some people consider the most important for preventing sun damage. So here's what we're all worried about. This is a melanoma. This is the worst, most dangerous type of skin cancer that you can get, particularly from those UVB rays. And it is very important that we minimize our sun damage to prevent or at least minimize the likelihood of getting melanoma. Here's some valuable statistics on melanoma, particularly when it comes to the sun. If you get a sunburn, not even a bad sunburn, just a sunburn on an area, once every 2 years, most of you are probably thinking, I go to the beach or a beach vacation once every 2 years, you triple your melanoma risk. But not only is the amount of sun exposure important, but the age at which you're exposed important, which again is why for my kids, I make them wear these sun shirts that aren't going to wash off. 5 blistering sunburns, and those are the worst, the second-degree burns where some of your skin peels off. But 5 blistering sunburns before age 20 increases your risk of getting a melanoma by 80%. So young skin is more sensitive to ultraviolet light, and recurrent damage also increases your risk of developing these dangerous types of skin cancer. So in summary, make sure you use sun protection, preferably a sun shirt, but at least sunscreen. If you're going to use sunscreen, make sure you use it liberally and frequently, and make sure that you get one for the sake of the older you who won't want all that sun damage, one that protects against both UVB and UVA. But certainly sunburns and the skin cancer that can come from them are not the only summer hazards. What my parents used to tell me a lot growing up is, summer came, I'm out of school, I'm young, so I'm not having a job yet. They said, Howard, go out and ride your bike. We bought that bike for a reason. Go out and get some exercise. And let's go on to the next slide. We'll see some kids dutifully riding their bikes. Well, riding bikes, very good exercise, very good for getting kids out of the house, but certainly at least somewhat dangerous. Nowadays, we know what the key ingredient to keeping bike riding safety is, and that we will see on the next slide, the bicycle helmet. Bicycle helmets, we have found more and more as time goes on to be incredibly important, especially for kids when you're out riding. The data shows that there is a 3 to 4 times increase in death rate if you don't wear your helmet while you're bike riding, and that wearing a helmet decreases the chance of having traumatic brain injury, serious brain damage, if you're in an accident on your bike by 52%. So making sure that you wear a helmet, both adults and kids, when you're riding bikes is very important. Despite that, there are 900 deaths a year as a result of bike riding, and 20% of those are children. Even with all of this information, less than 30% of people still admit to using a bike helmet regularly when riding their bike. So please, 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 if you're going to go out and ride your bike, or especially if you're going to send your children out riding their bikes, make sure they wear helmets, because the chance of death or serious head injury goes way down if you wear your bike helmets. And then there is the classic enjoyment of the summer, especially for those of you listening in Florida or Southern California, something that many of you may even have in your own backyard that is one of the top hazards of summer, the pool. Everyone loves the pool, especially on some of those hot summer days. But the pool is one of the most hazardous things, especially if you have one at your own house. There are 3,500 pool drownings a year in the United States, and 20% of those are in children under the age of 14. So when you're thinking about swimming and drowning deaths, what you really think of most of the time is someone maybe who gets caught in a rip current at the beach. And maybe there's a lifeguard and maybe there isn't, but that's not where most of these drownings occur. Most of these drownings occur in your own pool, and most of them occur when the children are being supervised by their parents. It is very, very important if you are a parent, especially if you have a pool in your house, that you take the proper steps to prevent childhood pool drownings. 2/3 of children who drown in a pool drown in their own private pool. And again, most of them are being supposedly supervised by the parents. But it takes so little time, less than a minute, for a kid, especially maybe a little toddler, to sneak away from their parents and fall in the pool. So many municipalities now have specific rules on locks and gates around pools, even in private pools of people's own houses. If you have a pool, especially a private pool in your own house, and you have a small child who does not know how to swim, make sure there are proper safety measures in place. Any sliding doors that you might have leading out to a patio or a pool deck, make sure they have extra locks on them that kids can't open. You'd be surprised at how good some of these kids are at getting around those standard locks. And make sure if you have a pool that you have to always be extra vigilant to make sure that those kids are never around that pool unsupervised. And when you are supervising them, be off of the cell phone, be off of the laptop. You have to keep a close eye on them because drowning in backyard pools is a real threat. So the final thing that I'm going to talk about today to keep in mind in the summer is that heat. It's only getting hotter. It's only June right now. July, August, it can get really hot. And these look like two fit people who maybe went out for a jog, or maybe you're at the beach, maybe you're out playing some soccer, and you start to sweat and you start to get hot, and maybe you don't want to take a break to have a drink. You have to make sure you stay hydrated, but everyone should always be vigilant for the signs of heat stroke. There are lots of levels to heat problems. It goes from just overheated to various levels, and then you get to heat stroke. So what are the symptoms of heat stroke that everyone should be aware of? People who have heat stroke have a body temperature of over 104. They'll get confused, nauseated, headaches, and they can even have seizures. And one of the classic symptoms is that people with heat stroke stop sweating. So you look at them, they say, I'm not feeling well. And you're like, oh, you're not even sweating. You can't be that hot. When you get heat stroke, your body has become so dehydrated that you stop sweating. So make sure you take time to take breaks, stay cool, and maintain proper hydration. Drink a lot of water, or even better, sports drinks that have extra electrolytes in them to stay hydrated to avoid the dangers of heat stroke. So hopefully with all of that, you've learned some new ways to specifically keep your body, keep your children, keep your head, and keep your whole system safe with the perils of the summer. So how can Activ Doctors Online help you avoid some of these summer health hazards? Well, Activ Doctors Online has some revolutionary solutions with our personal health records, our second medical opinions, and our e-consultations in particular that I'm going to focus on today, which allows you, if you and your doctor are both members of Activ Doctors Online, to communicate electronically and perhaps save you a visit. So maybe you have one of these spots on your skin and you're worried about whether it's melanoma or any other type of skin cancer. That's an awful long trip to the doctor's office, waiting 30 minutes for him maybe to see you in the waiting room, having to pay for parking at their parking lot outside just to look at a spot. So if you and your doctor are members of Activ Doctors Online, sometimes a 5-minute trip to your computer and holding your arm up to the webcam on your laptop can be all that it takes. So if you are a member of Activ Doctors Online, talk to your doctor about becoming a member as well. It's free for doctors to join, and you can start working with Activ Doctors to make seeing your doctor even more easy. With that, I'm going to turn it over to Tom, who will tell you a little bit more about Activ Doctors Online and how to get started.
Well, thank you, Dr. Zahalsky, for another great presentation. Here at Activ Doctors Online, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live healthier, safer, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to start a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any other questions about our service, please feel free to contact Activ Doctors Online using the information on screen. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.